Hi there, I'm Katey Rayner, and I am the co-chair of this year's Vascular Discovery meeting. And I'm here today with Nigel Mackman, who is a professor at UNC Chapel Hill. And he'll be giving a talk in our ATVB journal session about the links between thrombosis and cancer. So Nigel, tell us about sort of what got you and others thinking about thrombosis and cancer, and what are those links?
So I think it's interesting, the observation is that cancer patients have a 4 to 7-fold increased risk of venous thrombosis, not arterial thrombosis, that's lower, than the general population. And so something about that patient having an underlying cancer is causing thrombosis. And in fact, interestingly, about 10% of people with idiopathic venous thrombosis have an underlying occult cancer that they didn't know about. And that's the first presentation of that cancer.
Wow. So tell us then about how, in the work that you're going to be presenting at Vascular Discovery, what is your work bringing to the field, and how are we moving this forward?
So currently, there are risk assessment scores that try and identify the patients that are at higher risk of thrombosis than the other patients. And the rates of thrombosis are too low to actually anticoagulate everybody. So the goal is to try and identify those patients at higher risk using clinical biomarkers. And we want to bring to the table plasma biomarkers and other ways to try and improve the assessment scores so that we can be better at identifying the patients that will benefit from anticoagulant therapy to prevent the thrombosis, rather than just getting the thrombosis and then having to deal with it, because obviously that interrupts cancer therapy and is very deleterious to the patient. In fact, it's associated with increased mortality. So we want to try and avoid it by treating the patients prior to having an event. The other thing that we want to do is identify novel pathways that are associated with cancer-associated thrombosis. And we've seen that different types of cancer have different rates of thrombosis. So it suggests that the cancer-specific mechanisms of cancer-associated thrombosis. And if we can identify those, then potentially we can safely anticoagulate those patients without interrupting their normal coagulation profile, because a lot of these patients are prone to bleeding because they have a dysregulated clotting system. They're often have low blood platelet counts because of the chemotherapy that they're being exposed to. So if we can identify cancer-specific mechanisms of thrombosis, we can safely treat those patients.
So this sounds like it's really at the sort of the height of precision medicine, and that intersection between discovering new pathways, but also trying to identify what's best for the patient. Have you found that the medications that people are receiving, does that play a role as well in the way that the thrombosis is occurring in these different cancers?
Yes, so clearly the treatments can be deleterious. So chemotherapy is clearly increasing the rates of thrombosis by at least 2-fold. A good case is multiple myeloma, where you have a baseline rate of thrombosis about 5%. When they treat the patients with these multiple drugs, it goes up to 25%. So in that case, they have to anticoagulate to try and alleviate the side effect of the thrombosis that's induced by the chemotherapy drugs.
Okay, so where do you see this going? What looks like is in the future for this kind of work?
So what we like to do is to take the human disease, go back into a mouse model where we can do mechanistic studies and then identify pathways that can take back into the humans as a sort of treatment therapy. The 3 different pathways that have been identified by us and others are the tissue factor pathway, where the cancer cell will release prothrombotic tissue factor positive extracellular vesicles into the circulation that can trigger venous thrombosis. So that's one pathway, and that's particularly prevalent in pancreatic cancer. Another pathway is that there's elevated neutrophils, so the presence of the cancer will increase neutrophils in the blood. Neutrophils can produce neutrophil extracellular traps that can trigger thrombosis. So that's another pathway that appears to be prevalent in lung cancer and pancreatic cancer. And then the third pathway that I think is very intriguing, that was discovered by Ingrid Pabinger's lab in Vienna, is that the brain tumors express protoplanin, which is a ligand for CLEC2 on platelets. And they actually identified a drop in platelets associated with thrombosis, which is a bit counterintuitive. But they discovered that the platelets were dropping because they were being activated by protoplanin or vesicles coming out of the brain cancer. And so in that particular case, that is a identifiable target where you could potentially interrupt the thrombosis by blocking the protoplanin CLEC2 interaction. So those are three pathways that I think we've really worked out quite well in mouse models. The next challenge is actually coming out with druggable targets from those pathways to say, how can we get that into the clinic and safely reduce thrombosis in those cancer patients?
That's amazing. We look forward to hearing more of your talk at Vascular Discovery. So thank you very much, Nigel, and we will talk to you soon.
My pleasure. Looking forward to it.